izawungena ke thina ke i-department izawusinceda ngento yoba yena ivume uhlala nathi. If ayihlelanga nathi nawo noba nizanga sizayithathela kuthi le meta because asizuyivumela into yoba kuthitheke abantu bakuthi ngolu hlobo. So isicelo sam siyi-1, sizama bathathu thina from our side. Sizama bathathu thina from our side. Sicela ke ne-trade unions or i-delegation yenu sicelelwe ungena apha ngaphakathi sithethe nabo. This department belongs to us and singurhulumente nathi. Enkosi.
Mandoyi we-BcmTV. Namhlanje silapha eBHISHO phambi kwe-offices zakwa-Department of Health ngokukhwaza ke sisantu sabantu abasebenza kurhulumente wethu abangabanye ke sabonayo ukuthi zii-professional nurses nabanye kodwa ke kuthiwa aba bantu ngabantu bebesayina i-contract ye-COVID ngo-2020. Sizawuva ngabo ke bana ngobani lehlanganisela ilapha emveni kwethu bana ngobani nina niphuma kwi-department kwaye zeziphi ii-department ezikhoyo apha.
Enkosi kakhulu msasazi. Lo uthethayo umsasazi nguMr. Yonela Jet Madzanini Gxothiwe. I'm from the Union of Nurses. I'm from Dinosa. I'm leading that local ekuthiwa yi-Enoch Mgijimi in Krizani. Msasazi, apha we're in different categories. There are COVID-19 nurses. That means all these nurses that were employed by COVID-19 contracts, they are here. They are community health care workers, meaning those people that were employed as an assisting hand to the department. Also, we are having other professionals in the form of social workers, pharmacists, and other professionals that are here. So this is the combination of people that were employed by COVID-19 contracts in the form of professionals and general workers. And also, here we are having ComServe nurses. You will remember that thousands in nursing we enter a 4-year degree. Then lanyaka westanu you are regarded as a ComServe. Then let's suppose what department we've been here 2015 CCT after ugqibelo nyaka bekufanele uabsorb system automatically. So ibikathi qhubeka kisenzeka lonto beabsorbwa nabo, but starting from last year urhulumente wasijikela isigqibo asothukanga ke msasazi because we know we are being led by government okwazi ukuzijikela izigqibo ne-increment yethu mosayikapophi nangoku bazijikela izigqibo ze-increment. So we are not surprised that basijikela isigqibo se-absorption. So into esiyithethayo apha, all these people, COVID-19 contract workers and also the ComServe has to be absorbed so that baqeshwe basebenze. It can't be correct that msasazi abantu bazawusebenza during i-COVID-19 pandemic bejongene ne-COVID-19 ngqo whereas the whole country was in lockdown. Then ubaxelele that ngoku iphelile i-COVID phindelani yohlala phantsi. That is not correct msasazi. Further to that msasazi, abantu banezidingo. It can't be that uzabayuza ugqiba ubaxelele ubasisecaleni msasazi. So we are here for that msasazi. Siyeva ke that across the province. You can see that I'm also from Youth League. Comrades, these comrades, ANC is the governing organization, and soon see provincial conferences of the ANC. So we are appealing to the conscience of these leaders that ezizostanda kule conference that here we are the people and here we are the voters of the ANC. So bonke ke ngoku abantu ba-affected. Siyacela that these people must come and address these people. The voters voting. So masingadiscardwa nje ingathi there is a dustbin for a human being. We demand a full-time employment for these people.
We are taken back to the streets where we don't belong. We belong to our services, to our community service. Every now and then, he calling it we take this profession because sifuna kuba involved. It's not about betu. At some point, our band who come to the public services, but man is only as well we know we're in the COVID. We have SWs our social workers, our social workers they are counsel our band who have this stigma with COVID vaccine and all that stuff. So we're trying to save our country as in all. And then at the same time, sifuna SW as you know, but we COVID-19 vaccine rollout. We funa use numbers as much as we can. That is all we want. Sifuna umamelela kumqeshi because seemingly enda ngayifuna ukubana simsebenzele. What we want sifuna ukusebenza and we are breadwinners emakhaya ethu. Sifuna by all means to serve amakhaya ethu as they are looking at us. We are very painful ke xa singahoya sibona njengabantu nje abahleliyo nje we want to work.
This is just the phase 2 of the struggle. Phase 1 was just to follow the protocols. We've followed the protocols. We've wrote to the MECs, to the premiers, to HOD or Dr. Wagner. We've been receiving a very arrogant responses. So now we took this matter, now size this up. This is the second phase. There will be a third phase. This is not a threat but a promise. A third phase is that if urhulumente akafuna ukuza kule nto simcelayo uba makeze kuyo okanye senze le nto simcelayo uba makayenze, which is to absorb us, we will collapse the entire health system of the province. Sizobona ukuba lizawuphelana usuku kwimaternity ingasebenzi kungazalisi. We will see uba i-ICU lizawuphelana usuku abantu base-ICU bekwi-oxygen xa singekho thina. Because an injury to one is an injury to all. If aba baphelelwa zii-contracts, then sonke masiphelelwe zii-contracts. So the entire system will collapse. So ndizama uphendula ke msasazi laa mbuzo uthi sizawulasta kude kube nini until u-employer azosimamela enze le nto siyifunayo. Enkosi kakhulu msasazi.
Every category in our facilities ichaphazelekile. So ngoku we feel like nobana we gonna stand still xa kho ama-nets amangaka, ama-needs angaqashwanga. At the same time, asikwazi ukusebenza productively because into siyazi yokokuqala we have a shortage of staff. Even abantu besebesinetha be-helping hand yethu lokhu xa begxothwa we are struggling kakhulu. Enkosi msasazi.
Makerila.
Chio.
Chio.
Chio. Chio.
Ioni funa wena.
Ifuna wena sanda samio.
Ioni tina nawe.
Tina wena sanda samio. Ifuna wena sanda samio.
Ashubari waiwa.
Sangena kunye no coordinators of the different people abakhona apha namhlanje. Sangena singudinosa, sangena igerillas ze-EFF sikhapha apha ngaphakathi. Sithe xa sifika apha ngaphakathi safika kukhona abantu abathunyiweyo ukuthi bazosimamela. Then kwaba bantu bathunyiweyo bathi i-Labour Relations Act ayibavumeli ukuthi baqhube ba-engage kwi-meeting with i-political leaders because apha kwi-department inye i-politician u-MEC. Isana sinyusana ke ngaloo nto leyo, because even naxa bereferensa kwezi act zabo abathi according to section this of the act. No, bayasibalisela, they are telling us ukuthi according to the Labor Relations Act we cannot do that. Abe wona ama-fighter ebaxelela into yoba according to section whatever of the constitution, apha here on this capacity. But it seems that the negotiations or the rules themselves, ngendlela yokuthi as they were delegated by the heads of the department, they are going to call them and engage with them and tell them ukuthi what our stance is. They excused themselves and they spoke on the phone, and the response we got was that they were not able to get hold of the head of the department of the MEC, but they were able to get hold of the chief financial officer who's in the office of the ASG, and andisingoyena osezimali, very good ke ngoku. So bathethile ke no chief financial officer and the SG wathi ukwelokuba they will be able to meet with esigqeba besingenile pha ngaphakathi on the 24th. Batsho ke ukuthi they tried to speak to her, bamvezele the gravity of the situation by all means, but she can only secure the date of the 24th. Sathi ke on those grounds, yes, we are very much undermined and disrespected. Sathi on that response, and naxa esithi uzamile ngazo zonke indlela nazo, but the only date that is immediate anayo yi-24th, akho ngxaki sizayilinda apha ngoba we are going to camp here up until we receive the response that we want. So i-24th le asibekela yona, which is the day after tomorrow, she will find us here continuing with the program that we are doing right now. Exactly. And ke ngoku the onus will be upon her, and that the fact yokuthi apha we are disrupting the processes of ukusebenza kwabantu abakule building. Uyawubona ngokokwakhe umhlambi xa siqhuba kanje sawuva sekuthiwa hayi uthi uyeza ngomso.
Isizathu esibangela sibe lapha si-invitwe si-student nurses alapha e-Eastern Cape. I-problem yazo is that zinale program ebezinayo ne-department apho beziqhuba la program yazo zine-bursary ziyifumana kwi-state. Now i-contract yabo after beyigqibile yonke la process, that is le yoba besenza i-training and so on bade baye nakwi-community service and so on, beyigqibile bazawuabsorba permanent. That is black and white, is on a contract. But now the Eastern Cape government is breaching that contract now. That is the reason ebangele into babade bacela i-stakeholders outside ezifana nathi as EFF nezinye, because we are not the only stakeholder esikhoyo esilapha. Now we went inside with them, sizama into yoba si-assist to resolve the matter. But what we have noticed is that i-department inabantu abangena capacity to handle these matters. Because when we get there, one problem yento yoba thina they can't talk with the politicians. And we have tried into yoba msasazi sibavula amehlo to say sisi-stakeholder. I-stakeholder ezivunywa nguchapter 2 we-constitution yalapha eSouth Africa, that is i-Bill of Rights. Apho i-Bill of Rights kuthethwa ngento ye-enforcement of rights ku-section 38. Section 38 othi if there is anyone who contravenes i-section ekwi-Bill of Rights, i-stakeholders nelungelo longenelela. Because now we have noticed that bakontravena u-section 23 we-Bill of Rights. That uthetha ngento ye-labor relations. Apho uthi abasebenzi banelungelo lophatheka kakuhle. Indlela ke yophatheka kakuhle kabasebenzi yimithetho eye urhulumente wayibeka ngaphambili. Sine-legislation, sine-collective agreement nezinye. Now this one there is a contract between the employer and the employee, because the contract treats these people as the employer and the employee. Now the contract is existing. and clear intoni expectwayo from the employer. But the department now is failing to fulfill that obligation that is that is the new contract of employment. That is the reason why. The way forward, sikote safika kwi-deadlock, siye deadlock, but we told them indoba asinayo any option. We give them as a stakeholder, as EFF, we give them 24 hours to respond to these demands. If they fail to respond positively to these demands, we don't have any other option but to embark on an action now. That is a protest action. Remember, EFF is a protest movement. If sibeka le wena ungaqhubi ngalandlela and sibe sisazi intoba we are on the track, then we protest. So they must expect up at Buffalo City, because we are going to start it here at Buffalo City. That is the way ekuseqhutywa ngayo. Urhulumente wethu uthi ukuze amamele kube kuactwa ngolo hlobo. Yiyo msasazi into ebangela sibe silapha. So from tomorrow we are going to mobilize i-members zethu, i-communities, nezinye i-stakeholders, sizilidishe as i-EFF, as a vanguard of the society, as a vanguard of the community, as the vanguard of the working class. Sithini siforce i-department into yoba i-comply nantoni ne-agreement, that is ne-contract le. Enkosi msasazi lapha i-position yethu.
Ndiphuma kwi-Democratic Nursing Association. I think we are gathered here today with the reason that we have seen that the department was on the verge of failing to absorb community service nurses. Ithi ke loo nto kuthi ayikhange isiphathe kakuhle. Last week, if we can reflect back a little bit, there was a memorandum that was served. That memorandum was specific and clear that the department must source funds and see to it that these well sought after medical practitioners and healthcare workers are being absorbed by the department. As an organization that is organizing within the nursing fraternity in the Eastern Cape, we took a resolution that their plight is not going to go unnoticed. What we are going to do, we are going to please accompany them so that we engage the department and all those relevant structures, people that are responsible to see to it. How can we find a solution and a lasting solution in order to see to it that these healthcare workers were not losing them. As we can notice, as we can see, these are young people that we cannot take it lightly that they are going to find themselves out in the streets. It cannot be correct, therefore, that at this time in juncture, that also these healthcare workers, including other professionals that are within the sector, that are going to find themselves, their contracts being terminated, and also are going to find themselves with no jobs, that they were much more at the forefront of the COVID-19. Now it means, therefore, all the heads of the department, including the relevant structures, that they need to find the sources and see to it that we retain these employees. This is not only the call that we are only wanting to retain, but there's a bigger picture that we are looking into, that this picture is to make sure that its service delivery, especially healthcare to our people, is realized, because that is the mandate of the healthcare department. Now, we are trying to rectify that. Why we are resolute in this cause? Because we want to make sure that we improve on the poor service delivery of healthcare in the province. Currently, some of these nurses that are here are already, their contracts have been terminated. So we are talking about people that are outside the job. Currently, we are talking about 2 weeks that we are going to be out of some of these nurses that are here. So there can be no other means or any means that we are willing to take the fall of a shortfall in the current service delivery that is taking place, but aiming to make a bigger impact for the future, that we don't sustain or suffer such an occurrence in future. Hence, we are here today.
Remember, now in March, we are left with 7 working days. Then if you are saying that we have to rest, we have to sit, whereas we are left with those 7 days, then it means that we are going to be jobless. Department is clear, they have to absorb 2021 concerns. They have to hire workers. We are clear on that. And we tried to meet them on halfway, but since we are here today, they even gave us 24 of this coming 24 to meet with us, of which we are taking that as a delayed tactics, because we are here today and we are not willing to go anywhere else up until they hear our cry, up until they hear the cry that is coming from the ground. So that is our stance. We want to be clear to say departments must be able to meet us halfway, and the only way to meet us halfway is to say they are absorbing those community professional nurses to the system. That's all we are crying for.
I think it's support Sinaso. Most of the people that are at work, because we wanted to act responsible first. We said those that are not able to come and join us today, they must continue to serve our people. But until such time that we don't find expression of our demands for Itilondo, we can trigger any party that we know and will ensure that those workers are joining us. They are eager, they are ready, and they are waiting for us. But we are trying to ensure that the department has also played its role to see to it that it meets with the people that are responsible for this issue so that we can find a common solution. Because our aim is always to make sure that we put the priority of our people and the communities we serve. But when circumstances also, dictate, it means therefore we have to protect our right that tomorrow and the day after we must have a bread and butter issues being addressed. So, sinasi support and then Bamengat.
Hey!